Nearly 2 years into the conflict, Sudan is now the largest and the most devastating humanitarian crisis in the world. With its economy and social services system and infrastructure in near collapse and no end to the conflict in sight, we estimate that nearly 2/3 of Sudan's total population, more than 30 million people, will require humanitarian assistance this year. Famine is occurring in hotspots in at least 5 locations in Sudan, with an estimated 1.3 million children under 5 living in these areas. Over 3 million children under 5 are at imminent risk of deadly disease outbreaks, including cholera, malaria, and dengue, due to the failing health system. According to data analyzed by UNICEF and collected by service providers in Sudan, 221 cases of rape against children were reported in 2024 in 9 states. We estimate that 67% of these children are girls and 33% are boys. In 16 of the recorded cases, the children were under the age of 5. 4 of these were babies under the age of 1. The data only gives us a glimpse into what we know is a far more devastating crisis.
Madam President, the war in Sudan is a war on people, a reality that grows more evident by the day. The Rapid Support Forces, the Sudanese Armed Forces, and other parties to the conflict are not only failing to protect civilians, they are actively compounding their suffering. As my esteemed colleague from UNICEF has eloquently described, sexual violence is pervasive in Sudan. In South Darfur, throughout 2024, our teams provided care to 385 survivors of sexual violence. The vast majority, including some younger than 5, had been raped, often by armed men. Nearly half were assaulted while working in the fields. Women and girls are not merely unprotected, they are being brutally targeted.